Myasthenia gravis is a chronic autoimmune neuromuscular disease resulting in the weakness of the voluntary muscles in the body. Myasthenia gravis is not genetic or associated with gender or race, but commonly affects women under 40 and men over 60 years of age. This disease affects 1 out of every 5,000 people in the United States. People who suffer from myasthenia gravis are more likely to suffer from other autoimmune diseases as well. The thymus gland is irregular in 75% of patients, and tumors on the thymus are reported in up to 30% of patients. In patients with the tumor, also known as a thymoma, the symptoms are more severe.
The thymus is the main producer of T cells, which produce antibodies. In autoimmune diseases, these antibodies attack the native cells of the body. When an irregularity or tumor occurs in the thymus due to myasthenia gravis, these T cells attack the acetylcholine receptors on muscle fibers. In people without the disease, muscle contractions are controlled by nerve impulses that originate in the central nervous system. Specific neurons, motor neurons, are connected to muscle fibers by a synapse. Myasthenia gravis causes a defect in the connection between the motor neuron and the muscle fiber.
Here is a short clip which demonstrates action potential.
An action potential arrives at the presynaptic terminal, causing voltage-gated calcium ion channels to open, increasing the calcium ion permeability of the presynaptic terminal cell membrane. Calcium ions enter the presynaptic terminal and cause vesicles to release their neurotransmitter acetylcholine from the synaptic vesicles into the presynaptic cleft. Diffusion of acetylcholine across the synaptic cleft and binding of acetylcholine to acetylcholine receptors on the postsynaptic muscle fiber membrane causes an increase in the permeability of ligand-gated sodium ion channels. The movement of sodium ions into the muscle cell results in depolarization of the postsynaptic membrane. Once threshold has been reached, a postsynaptic action potential is generated and is propagated over the muscle cell membrane.
When stimulated through action potential, the motor neuron should release acetylcholine into the synaptic cleft. Because of the defect, antigen receptors on the T cells are unable to identify native cells, leading them to attack acetylcholine receptors at the neuromuscular junction by altering, blocking, or destroying the receptors. As a result, the muscle cannot contract. This improper connection causes symptoms that include partial paralysis of the eye muscles, double vision, slurred speech, weakening of the neck and jaw, problems chewing and swallowing, and overall muscle weakness.
There is no cure for this disease, but there are treatments that can lessen the severity of the symptoms, and remission is possible. Some of these treatments include drug therapies, blood plasma exchange, intravenous immunoglobulin, which is when antibodies from donated blood are injected into the patient, or a surgical removal of the thymus.
Myasthenia gravis is a disease that not many people know about. This chronic disease can be very serious and drastically affect the livelihood of those who have it. It can be difficult for people with the disease to find information and support. Myasthenia gravis can lead to anxiety and depression, so support for these patients is essential. Raising awareness about this disease to the general public, along with caregivers and medical professionals, will not only help provide better health care for those who suffer from it, but will also ensure that they get the support they need and deserve.